Interested in an occupation with variety? Physicians can pursue many different specialties. Some choose to become a family physician or general practitioner, GP for short. We visited one to find out more.
My name is Alison Martel, and I'm a family physician, and I work in Edmonton. A family physician is a physician that looks after people from basically birth to death and all the way in between. So we look after babies, we look after teenagers, we look after adolescents and adults and elderly people and people that are dying. So one of the really neat things about family medicine is that we look after whole families. One of my typical days as a family physician is that I would drop my kids off to the school, go to the hospital and see maybe one or two patients that I have admitted in. Then I would come to the office and I would see patients all day. Some of the exciting things that can happen in a family doctor's office is that you never know what's going to come in. So certainly I can have patients booked for a stomach ache and it turns out that they're having a heart attack in your office. So that can be, distressing for everybody, including the staff, but that does happen in a family doctor's office. And some days it's sort of what you expect. You see patients and they come in for what they're complaining about. You help them out and solve the problems as best you can. Hi, Anita. Hi. How are you today? When I first see a patient in the office, there's two components to what we do. We take a history, which is basically sitting and listening to the patient and asking, sort of pertinent questions. So if somebody says, they have pain in their tummy, well, then you talk about, well, what kind of pain is it and where is it and how long does it last and all those features. So a big part of what I do is I listen to the patients. And then I do the physical exam part, which is examining the patient, having a feel of their tummy, listening with my stethoscope. And then I, in my mind, list the potential diagnoses in my head and think about what investigations that I want to do to sort of prove myself right or wrong or prove the diagnosis. And then I look at my treatment options. Now, sometimes I do that in one visit. I can formulate a diagnosis, make the diagnosis, try the treatment, and then get them back for follow-up. Once I make a diagnosis, sometimes the treatment's very simple. I can write a prescription and then see them in follow-up and see that they're better. Sometimes I know that I need to have some help with that, and as a family physician, it's really important to know where your skills are and where you need help from specialists, and that's why we have all these wonderful specialists to help us. As a family physician, I also carry a beeper. So one night a week, I carry a beeper for 24 hours and answer patients' questions or concerns that they have. I also take call. So what that entails is if a patient phones my office after hours and has a question, a concern about their health, they can reach one of us in the office. We rotate what nights we do in the week. I think when we talk about work-life balance, I talk about that with my patients every day, and so it is a very big reminder to me that I have to strive for that. It is critical for me to have time with my kids and my husband. We do a lot of fun stuff. We like to skate in the river valley. We like to ski and snowboard in the winter, so that really sort of helps me keep my stress under control and gets me out in some fresh air and gets some exercise, which is very important for all of us. There is the learning part of medicine, which is very important. You have to know your medications, you have to know your illnesses, your diseases to make the diagnosis. But then there's the art of medicine, which is truly helping people cope with their chronic diseases or their illnesses that they struggle with. One of the very great things about family medicine is that you really connect with people and you know their innermost secrets sometimes, and you've been through a lot with your patients, so you develop really great relationships, and they are still your patients, but they become very special to you. I think it's one of the best jobs in the world. I think it's full of challenges. I think that if you enjoy people and you enjoy being challenged, it truly is a very fulfilling profession.
To become a family physician, you will typically require 8 or more years of post-secondary studies. If working as a physician interests you, there's more information available, including salary ranges and educational requirements in the occupational profiles on ALICE. Find out about other areas where physicians can specialize, aspects of human health, like psychiatry, cardiology, and ophthalmology, or specific populations, like pediatrics, geriatric medicine, and sport medicine. Learn more on the ALICE website and make the most of your future. Visit us at alice.alberta.ca.